goodwill messages. 2 minutes each. The first one is from Professor Sam Agu, the Royal College Liaison Officer for us on our projects, Dr. Jayola from Japaigo, and the Paramount Ruler of Uyo. Please, Professor Sam Agu, 2 minutes.
Thank you very much. Your Excellency, the traditional ruler of Uyo, Sogon President, all other protocols observed. I, on behalf of the President of the Royal College of Obstetricians in London, as Professor Rani Taka, wish to thank you all for inviting us. We recognize that Sogon has been in the forefront of improving the health of women in this country, and Sogon remains one of the major partners of the RCOG. And we are very happy to be associated with you, and we look forward to further collaborations with this great society. So thank you very much, and we wish you a very good and successful conference this period. Thank you.
Thank you. Thank you, Professor Sam Agu. Dr. Jayola from Japaigo, 2 minutes. Please, a round of applause for him. It's not easy. Come now.
Your Excellency, the President of Sogon and all the executives, my very senior colleagues and teachers, distinguished ladies and gentlemen. On behalf of the Country Director of Japaigo, Dr. Adetilo Yonire, I wish to congratulate Sogon and the Akwa Ibom State Government for successfully hosting this year's AGM and Scientific Conference. Japaigo is being a partner with Sogon. In fact, the founding country director of Japaigo, Professor Emmanuel Otoloring, who is present in this meeting, is one of the elders of Sogon. On behalf of Japaigo, I hereby wish to reassure Sogon that we will continue to partner with Sogon and continue to provide all the support that is necessary to ensure that Sogon is successful in all its endeavors. And we hereby wish Sogon and everyone present here a successful conference. Thank you.
Thank you very much. I would like to especially recognize the presence here of the Honorable Commissioner of Health, Akwa Ibom State, Professor Augustine Vincent Umo, who is also the co-chairman of the local organizing committee. You're welcome, sir. The third goodwill message will be given by the royal father of the day, the landlord of Uyo, Edidem Sylvanus Okon JP, the paramount ruler of Uyo, for he will need to formally give us his royal blessings. Edidem. Thank you, Your Royal Majesty, for that very brief. So at this point, we have the honor and privilege of inviting a man who, in a short space of time, in less than 2 years, has changed the fabric of our state. The governor of Akwa Ibom State, Pastor Basi Umoino, has been able, we are all health professionals, but I can attest to the fact that his emphasis has been in the forgotten area of health, primary health care. He has done so much in primary health care and also in primary education, amongst others. He has sent his representative, also a lady of no mean repute. She's been a commissioner, a senator, and now the deputy governor of Akwa Ibom State. Ladies and gentlemen, I have the honor and privilege of inviting to the podium the Deputy Governor of Akwa Ibom State, Senator Dr. Akon Eyak-Enyi. Please, Ma, I would ask the President of Sogon to please join you before you give your address to do a few awards. We know your time is very short. So I would invite the President of Sogon, Professor Okechukwu Ikpeze, to please join her and then do the awards. So after she does her speech, we can release her. Thank you.
The Her Excellency Zone. Okay. So the first award will be for excellence in service to Sogon, and is a posthumous award to our immediate past president, Dr. Habib Sadauki. I will enjoin Professor Tuko to come and receive the award on behalf of Dr. Sadauki. Please, the citations of the awardees are on the brochure. If we start, like for OUJ Umar and Professor Mbasi, we won't leave here today. The next award will be for excellence in research. And of course, it is to our own chairman of Eastern Sector, Professor OUJ Umara. Thank you, Mr. President. The next award will be for excellence in administration, and is going to no other person than the past Commissioner of Health in Akwa Ibom State, the chairman of Committee of CMDs, and the Chief Medical Director, University of Uyo Teaching Hospital, Professor M.M. Bassi. Thank you, Mr. President. The last award, but not the least, is also a posthumous award of service to humanity to Her Excellency, the late Pastor Ino Umo, and the Deputy Governor will receive this award on behalf of the First Family. Her Excellency can now give her welcome speech and declare the opening ceremony open.
my youth a pillar of support and a dependable partner through thick and thin. As we prepare to commit her body to Mother Earth tomorrow, honoring your invite today is an eloquent testament to my commitments to effectively ensure that healthcare delivery in Akwa Ibom states and the level of regard I have for gynecology in particular and the medical profession as a whole. Moreover, considering my wife's passion for everything that concerns women and children, I am convinced she would have encouraged me to be here if she could give an opinion. On the other hand, this is a program which aims to generate ideas for the preservation of lives and the perpetuation of mankind. Healthcare matters to us in this administration. Hence, our massive investments in the sector, especially in primary healthcare delivery system. As I speak, we have already commissioned some model health centers equipped with modern facilities, power supply, and staff quarters, while many others are at advanced stages of completion. Before the end of next year, each local government area of this state will have at least one model health center. With these facilities at the grassroots, there will be improved access to health care and a substantial reduction in the rate of maternal and neonatal mortality. Our goal is to align with the vision of the World Health Organization, who, in being a state where every pregnant woman and newborn baby receives quality care throughout pregnancy, childbirth, and postnatal period. We are also consciously in pursuit of Goal 3, number 1 of the Sustainable Development Goals, that's the SDGs, of reducing maternal mortality ratio to less than 7 per every 100 births by 2030. There is no gainsaying that with these facilities cited in the grassroots, the issue of pregnant women delivering at home, courtesy of untrained traditional birth attendants, will be largely addressed. Permit me to observe that the theme of this conference, sustaining quality maternal and child health in a challenging economy, captures our efforts vis-a-vis the daunting task of ensuring access to quality health care by women, children, and indeed all Akwa Ibomites in the face of declining and the purchasing power of the families. Access to health care, especially child and maternal care, is so crucial that it shouldn't be left to the hands of just anybody or to the realities of the economy. That's why government is intervening. The socioeconomic consequences of a higher maternal mortality rate and a lower life expectancy than we currently experience can only be imagined. I am confident this conference will take advantage of the expertise of the delegates to arrive at a recommendations which will help governments in Nigeria and other stakeholders to ensure the availability of global standards healthcare despite our current economic challenges. To further demonstrate our commitment to healthcare delivery in the state, we are determined to maximize the facilities and opportunities offered by Ibom Specialist Hospital by allowing it run as a private concern, just like our wave-making Ibom Air. We will build a befitting doctor's quarters and provide the personnel with the level of comfort which will enhance their productivity. I believe we can halt the brain drain in the medical sector and minimize medical tourism, which has cost us so much revenue in foreign exchange. Furthermore, it is consoling that this noble and highly rated organization of Sogon, of well-trained professionals, is recognizing or has recognized my wife's contribution to women's health and advocacy against gender-based violence with a posthumous award of excellence in service to humanity. On behalf of our children and the entire state, I am receiving the award in the assurance that my wife's efforts were not in vain, and her legacies will live forever. Despite everything we have achieved as individuals, in the final analysis, what matters is our legacy. I thank God for the legacy of selfless service and impact that my wife has left behind as a memorial for her name. And again, I want to say thank you very much, Mr. President, the ESCO members, for the award. As I conclude this speech, I consider it necessary to acknowledge the Chairman, Local Organizing Committee, Professor Emembasi, the Secretary, Dr. Mataya Zaba, and all members of the committee for working so hard to put together this conference. I am sure they will help our guests enjoy the serene ambience, the peaceful environment, and relish the delicious cuisines of our state. Professor Membasi ensure they eat afang, they eat fisherman soup, they eat ekpang koko and everything before they go. Remember, hospitality lives in Akwa Ibom State. That's what we are known for. I wish you a successful and memorable conference. With this, I stand on behalf of the Governor of Akwa Ibom State, Pastor Umar Basi Eno, to declare open the 58th conference of Sogon holding in Akwa Ibom State today, in the name of God the Father, the Son, and the Holy Ghost. God bless you all.
Thank you, Your Excellency. Please, we crave your indulgence. Please take a group photograph with the members of the high table, please. Thank you, ma'am.
So after that, please, you permit me to step aside, and even the Commissioner of Health, he was needed in the village because he's heading the medical committee, and today is the last day for us to tidy up everything. So please, he won't be abandoning you. Just permit him for that service. God bless you.
Anna, how you doing? How you doing? Yeah, our conference has started. Deputy Governor is good. Yeah, I came over here. Okay. Give me space. Okay. Okay.
While we are waiting for the members of the high table to come back, Professor Patrick Daru, you're needed. The next thing on our agenda is the keynote presentation by the guest speaker, and the topic is sustaining quality maternal and child health in a challenging economy. And of course, the presenter is Professor Innocent A.O. Uja, MNI, And to read his citation will be Professor Patrick Hechdaru, the editor of TJOG. Daru?
You wait until the president comes.
The president is already here.
The
president is here.
Okay.
Finally. Go ahead, please.
Yeah. I hope those people.
Training program. He was my head of department. He was a vice chancellor. He was almost everything. So permit me to, for the very first time, appeal to my teacher to stand up for recognition, sir. Sir, would you mind coming over here so that people will see you well? Thank you, sir. We're honored. Professor Innocent Achanya Otobu Uja was born on the 6th of November, 1954, to the family of Chief Abba Ame of Aidogodo in Opoku local government area of Benue State. He had his secondary education at Government Secondary School, Katsina Ala, and had his higher school certificate education at the prestigious Government College, Kefi, now in Nasarawa State. It was in Benue Plateau State at that time. They moved to Plateau State, and it has now moved to Nasarawa State. Professor Uja studied medicine at Ahmadu Bello University, Zaria, and graduated with an MBBS degree in June 1978. He is a fellow of the Medical College of Obstetrics and Gynecology of the National Postgraduate Medical College of Nigeria. He's a fellow of the International College of Surgeons. Professor Uja is an alumnus of the prestigious National Institute for Policy and Strategic Studies. Therefore, you cannot call Professor Uja without adding the MNI. Because if you call his name without MNI, you are on your own. He holds a postgraduate diploma in management from the University of Jos with special interest in health services management in 1992. Professor Uja had steady career progression after joining the services of the University of Jos and Jos University Teaching Hospital in 1988 as lecturer and consultant, and got promoted to Professor of Obstetrics and Gynecology by the year 2001. He specializes in gynecological oncology and endocrine infertility, as well as maternal and reproductive health. He holds a diploma in international maternal health care from University of Uppsala in Sweden in 1993. Professor Uja has published widely and has over 120 scholarly articles in reputable national and international peer-reviewed journals, including the Tropical Journal of O&G. When he was Vice Chancellor, he published. I think we deserve a round of applause. Because as Vice Chancellor, despite the work, he still had time to write and publish. Professor Uja was head Department of Obstetrics and Gynecology between 1994 to 2000, member Council of Medical and Dental Council of Nigeria 1990 to 1994, first phase, 2004 to 2007, second phase, 2009 to 2011, third phase, and 2013 to 2015. So he has been member of Council of Medical and Dental Council 4 times and counting. Don't you think he deserves a round of applause? Professor Uja served as Vice Chancellor of Medical and Dental Council of Nigeria, Vice Chairman of Medical and Dental Council of Nigeria, and because of that, he was given another term as council member. So he has served Medical and Dental Council 5 times. I think that's a record. I don't think anybody has that record. That council was dissolved in 2015 and member of the Council of MDCN by May 2020 to 2022. He was Dean, Faculty of Medical Sciences, University of Jos from 2006 to September 2008. Professor IAO Uja MNI has work experience with the United Nations when he worked with UNICEF as health officer in A Field Office in Enugu. That was in 2002 to 2003. And later at the UNICEF National Office, Abuja, 2003 to 2004, in the same capacity. He was appointed Director General and Chief Executive Officer of the Nigerian Institute of Medical Research, NIMA, in 2010 to 2014. And he was a member of the Implementation Project Committee on the establishment of a new teaching hospital at Otukpo. Now, this is very important, and I think we need to listen to this very carefully. Professor Uja was a co-chair of the Treatment Research Group on the Ebola virus disease, co-chair. So he is paramount, and because of that work, Nigeria was saved of the Ebola. We only remember Dr. Adadevo, the late Dr. Adadevo, because she died. But he championed the establishment of that group to curtail the spread of Ebola virus. I think we need to clap for him. Professor Uja has spent over 41 years in the service of his profession in many capacities, including second and first vice president, National Association of Resident Doctors, for which he is a life member, second vice president and first vice president of Nigeria Medical Association, between 1992 to 1997. He was Secretary General of the SOGON between 2005 to 2010, was member of Council of SOGON from 1993 to date, and is the longest serving council member of SOGON, and a fellow of the Nigerian Society of Endocrinology and Metabolism. The community services he has rendered are many, so I'll just abridge it because of His Royal Highness here. The Professor Uja, Innocent Uja, established, among other sons of Okpagwa of the defunct Okpoga Community Bank in 1995, which later transformed to Okpoga Microfinance Bank in 2008. He is a director and later elected vice chairman . Please, can we put our hands together for Professor Uja, MNI, OON? Thank you very much. Thank you, sir. We are privileged.
You've done a good job. Well, I hope somebody is there to man His Excellency, the Executive Governor of Akwa Ibom State here represented, the Honorable Commissioner for Health, Professor Umar, who has left. He was an ESCO member in my NOC when I was president of NMA as an editor. The president of Sogon, Professor O.C. Ikpeze, and his ESCO, and the second vice president, first vice president, second vice president, the Assistant Secretary General, the National Treasurer, Dr. Merami Zara Fatima. Yes, it's one of the things I have observed, that the president is not even here. And this is supposed to be a keynote speech. I don't think that is good enough. So wherever the president is, he should be here. Because we have to show leadership. Past presidents and secretary generals of Sogon, our elders, Professor Emmanuel Otolorin. Emmanuel Otolorin must be specially mentioned because he is our elder, the oldest person in this place, even though we have not taken their age, bone scanning. But one thing I remember, Professor Otolorin, was that when I was a member of Medical and Dental Council, his father was the chairman of council. And what I remember about him is that when he finishes all the meetings, then he will go to Latin. In saying that there's no other business, he say nomina decante, in nomina decante. That means in the absence of any other business. You know, and I remember it tomorrow, sir. It makes a lot of impression on me. So you can see how far I have received my tutelage from your dad in the 90s. So I'm very grateful, sir. We have my Oga and an alumnus of my university, Professor Eric Achibong. I am delighted to see you, and with all other elders that are here, a past president